The Indianapolis public school system is potentially shifting from having traditional public schools to becoming fully charter. It's an incredibly nuanced debate centering around how Indiana funds and operates its schools, and it's highly contentious. Let's talk about it. House Bill 1136, authored by Indiana Republican Representative Jake Teshka, addresses students attending schools outside the district that they live in. According to the Indianapolis Star, this bill would only apply to school districts where more than 50% of students living within a district's boundaries are choosing to attend other schools, meaning that their property taxes fund a school system they don't attend. Those districts would then be dissolved and transitioned to charter schools. 4 additional school districts in the state of Indiana would be affected by this bill, totaling 68 public schools that could turn into charter schools. As always, let's look at both sides of the debate. Proponents of the charter-only model believe that it would increase school choice, promote innovation, and improve student outcomes through competition. They believe that by freeing schools from certain district regulations, they can better tailor their program to student needs. There's also the argument that funding should follow the student, aka people shouldn't pay taxes to a district their kids don't attend, despite the fact that they live in that district. Those against going charter only emphasize the importance of community oversight. They argue for ensuring equitable access across all schools and for maintaining governmental accountability that the established public school infrastructure demands. They fear a system with only charter schools could lead to increased segregation and less accountability, raising concerns about equity and access, especially in rural and underserved areas. In contrast to those who support the bill, those who argue the importance of keeping IPS feel it is the responsibility of, for lack of better words, the public to fund public education, even if your own kids are not enrolled. If this debate is setting off your mental alarm bells for conversations surrounding public health, you're on the right track. This situation in Indiana reflects a broader conversation about the role, perception, and state of public education in this country, especially as we see declining public school enrollment nationwide. What are your thoughts? Let's talk in the comments.